Okay, good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. Paul Thomas and Bill Kearney of North Lake Medical Pharmacies. Welcome back, Bill. How are we today?
Thank you. I thought I was in the wrong place. I went outside and I saw the yellow tape. I thought maybe you'd been shot.
Yeah, they're painting the front of the building, I guess, as part of the Main Street's beautification thing. I don't know all the particulars about it, but I know it has something to do with that. We are going to get our paint redone, I guess, on the front of the building.
The same color? Or?
I think they're doing the same color, yeah. So
they asked me to give them a plug, and I said, that's not... I said, I pay a lot of money to be on the air.
Yeah, right?
So,
the painters did?
Yeah.
Really? Good Lord.
He said, you have the radio station? I said, no, I own a pharmacy, and well, you know, when you get on the air, you could say something about...
oh, my goodness, really? Wow.
But anyway, we're here to talk about your health, not the painting. And,
oh, boy.
Beautiful
Another day. I know. What is going on around here? It's like...
I've been swimming every night. It's just been...
People are freaking out.
I know, and
what's going to happen here? Is we going to freeze? Are we going to have a sudden freeze all of a sudden? My wife wants to go plant flowers like crazy, and I bought her some tulips for Valentine's Day, and they're live. They're they're not the cut ones. And there was like one that had bloomed when I bought it. Now the whole thing has just exploded, and she keeps saying she wants to put it in the ground. And I say, I don't know if you should do that. It might freeze still. Well,
you plant tulips it's okay if it freezes, but usually you plant them in November and December, and then they. And I remember maybe 15 years ago we were going to Hawaii, and it was during Valentine's Day, and I had up and down my driveway I had red tulips up before Valentine's Day, all up and down the driveway, and. So this isn't unusual, but it's the kind of time that we need the winter rain. And I see the lake keeps coming up all the time. It's like at 4.8 now.
I know, and Lake Mendocino looks good.
But we have other things to worry about, and we'll focus on those the best we can. And the big thing, and I'm never sure whether I should talk about it or not because it's not imminent here, but it is imminent worldwide, and I have to realize that we travel, many of us, and I'm thinking about spring break now, where people are going to these Zika countries, these warm climates where the Zika virus can be, and the CDC just came out with a recommendation that men who were in Zika areas, even if they haven't been tested, should make sure they use condoms. So. They said on Friday that men who have been to a Zika outbreak region should use condom if they have sex with a pregnant woman and for the entire duration of pregnancy. And they also said that men might consider abstaining or using condoms even having sex with a woman who isn't pregnant. I know this is highly unusual that we get into the sexual aspect, but this has to do with transmitting a virus that is still mainly spread by mosquitoes, and in most people it causes mild or no symptoms, so it has become a concern because of the possible link with the birth defect in Brazil called microcephaly. The CDC has recommended that pregnant women postpone trips to countries with Zika, mostly in Latin America and the Caribbean. All travelers are advised to use insect repellent and take other steps to avoid mosquito bites. And the CDC also said on Friday it updated its guidelines for testing and monitoring pregnant women who've traveled to Zika areas. In the United States, there have been 50 cases of travelers diagnosed with the virus, including 3 pregnant women. So it is a threat to us, and because the symptoms are so like other things that you could get, including rheumatoid arthritis, chronic fatigue syndrome, fibromyalgia, any of those immune system things with this, it could even be like a cold. So I would be very, very cautious in going to those countries. I was going to go on a trip through the Panama Canal that I've since canceled, not because of the Zika virus, but I'm glad that I did. because it would have been through Latin America and many of the South American countries. So we're kind of glad that we're not going on that. Of course, healthcare comes into the headlines every day because of the election coming up in November. Again, it looks like a Hillary Clinton and a Donald Trump type situation at this point. Both are complete opposites, one's to the far left and one's to the far right. And somewhere in the middle we have to come to an agreement to elect either one of these people. So keep your eye on healthcare. I keep telling people that it's only going to get worse. I have these experiences of people going to hospitals and getting looked at and then sent home, and then there's no post follow-up maintenance on taking care of these people, and it's only going to get worse. Fewer and fewer physicians are going into rural areas such as Lake County. So you're going to see more and more nurse practitioners, more and more physician's assistants, and you're going to see a lot more pharmacists that are highly involved in healthcare. Eventually, they will be prescribing medications for birth control pills, for naloxone, which is to reverse opiate addiction or opiate overdosage, for antibiotics, for different immunizations, and many of those things are have been okayed by law in California, and they have to be implemented and cease smoking and prescribe medications for those. So a lot of those things will begin to and being tested for high cholesterol and other disease states, and then do further action on this. There will be additional licenses. You'll still be a registered pharmacist, but you'll have a clinical license in those areas as the Board of Pharmacy defines those things in more detail, so we're aware of what the liability is on it. So I know some of you aren't comfortable going to a pharmacist. Some of you aren't comfortable going to a nurse practitioner, but you're going to have to get used to it because that's your only option to get health care in rural areas. There are physicians here. They're going to be highly involved in the community, but they're probably also going to have closed practices because we're losing more and more. One of our great family practitioners, Dr. Gary Mays, is cutting back now, and they will have nurse practitioners and nursing assistants that will be helping them. More and more physicians are retiring, and somebody has to replace them. And right now there isn't a high balance of physicians seeking out rural health. The reason? Money. Unless you're a surgeon or a specialist in a field, you can't really make pharmacists sometimes make more than physicians right now. And that's a tragedy. I'm not saying that pharmacists aren't worth that, but physicians are worth that also. They give up 8 years of their lives plus to become a physician, and they need to get those loans paid off when they have a graduation and they start working. They need to pay the loans off, and those loans are $250,000 and up. So I don't blame them at all. I realize how expensive college is and how expensive a medical school is, and you have to be able to borrow money to get through because you're working all the time in college. This isn't 8 hours here and 8 hours there. This is 12 to 24 hours a day, especially when you get in your residency and your internship. So, and then if you go into another specialty, the same thing over again. So just be aware that as President Obama leaves office, there are a lot more provisions of the Health Care Act that are going to be implemented, and that was designed purposely to happen once he got out of office. So what you think is high now for an insurance bill will get even higher. What you think now is a narrow scope of practice that's involved with your health care will get even narrower. It's going to be you pay for the minimum plan, and that's what you get. You pay for a lot of the other services, and those will be an additional cost that used to be included in your major health benefit plan. So I don't like to give bad news, but you need to prepare yourself. And what I'm telling you is that you need to be aggressive in your health care. If you go to a physician and you get an MRI and 3 or 4 weeks later you don't hear anything about it, you call them. And it's your MRI. You paid for it. So you may have to go to the hospital and pick up your own and take it into the doctor's office. That isn't intentional. It's just that there are so few physicians now that they don't have a lot of time. And if they have been around reaching retirement age, they're not working full time. So you need to be aggressive in your health care and have somebody respond to you. You're paying for it. It's not free. Even if you're on Medi-Cal, it's somebody's paying the bill for that. So, Paul, have you ever heard of homeopathic medicine?
Homeopathic medicine. Yes, I've heard of it.
Do you know what it is?
Isn't it like kind of like a home remedy or
no?
No. Isn't it kind of like a non-drug remedy?
No, it is actually a drug that's diluted down hundreds of a percent until it doesn't have an equivalent that really seems to be effective in the system. And a lot of disease, and you know, I'm just reporting this because I know a lot of people that take homeopathic medicine and it works. Lots of children are taking homeopathic medicine. Lots of adults take it for the cold and the flu. It's all kinds of different drugs. But there was a study that was just done from a professor, and I don't exactly know where this was. It was overseas, and at Bond University, and he was the chair of the working party of the National Health and Medical Research Council, which was tasked with the evidence of 176 trials of homeopathic medicine to establish that the treatment was valid. So they did a total of 57 systemic reviews containing the 106 studies, focused on 68 different health conditions, and found there was no evidence that homeopathy was more effective than a placebo on any of those. Now, homeopathic medicine is kind of expensive, and it's a diluted micro dose of what the real pharmaceutical dose would be. And it's an alternative medicine based on the idea of diluting a substance in water according to the National Health Service. So practitioners believe that the more a substance is diluted in this way, the greater its power to treat symptoms. Many homeopathic remedies consist of substances that have been diluted many times in water until there is none or almost none of the original substance left. What the review found was no discernible, convincing evidence beyond the placebo, and concluded there was no reliable evidence from research in humans that homeopathy was effective for treating the range of health conditions considered. They wrote this in the British Medical Journal last week, and the professor that did the study said, as the chair of the working party, I simply relieved that the journey of sifting and synthesizing the evidence was at an end. I'd begun the journey with I don't know attitude, curious about whether it really works or not. But he said, I lost interest after looking at 57 systemic reviews, which contained 176 studies, and finding no discernible convincing effects beyond a placebo. So the founder, Samuel Hahnemann, was the founder of homeopathy, was dissatisfied with the state of the 18th century medicine practices such as bloodletting and purging, and tried to find a better alternative. And you have to remember, these are all natural So they're not under a guidance by the FDA. I guess he'd be disappointed by the failure of this to carry on innovative investigations. But in the UK, 2 National Health Service hospitals provide homeopathy as well as a number of general practitioner services. And I know in the Santa Rosa area and possibly in the Ukiah area and possibly in Lake County, there are several physicians who do believe in homeopathy. And whether it's the placebo effect or not, it appears to work with many, many people. So we'll have to see in the future. I doubt if it slows the sale down of homeopathic medicines. Those people that are into homeopathy really believe that it's effective. And I've even taken some of the medication for flu and assumed it worked. But if you look at even Tamiflu, they'll say it maybe cuts it by a day or a day and a half. So,
Bill, I got a question real quick for you, Bill.
Mm-hmm.
I had a mother of one of my son's friends. We were talking the other day about the sickness that just keeps coming around, and it seems to be in my house that somebody is sick and then the next person gets it, and it kind of cycles around again. And her comment was, I don't even know why we ever get these flu shots. They never seem to work. And then last year, I remember you telling me that a big percentage of the flu was not covered in the shot. Are we finding that again this year? Do we know early on? Or?
Well, I haven't heard that because the flu epidemic is just now really starting out,
to go,
really late for this year. I've had several people out. I don't know that it's the flu. It's a bronchitis type
it's a
thing.
Weird thing, yeah.
And there's hundreds of viruses out there that could be not flu. Mm-hmm. But most people don't have a fever. Some people do, and it's only a slight fever.
Yeah.
That's usually the difference between the flu and a cold. But there are plenty of viruses that don't respond to antibiotics. And the cough is another thing that's very prevalent.
So what about allergies right now? Are they ramping up? Because
it
seems like
the trees are really throwing off allergies right now. Mm-hmm. And I just talked to a pediatrician that was actually treating the child for migraine headaches that she felt like was caused by the allergies in the air, and gave the patient an antihistamine. And it seemed to help a great deal. So there are the allergies are bad out there right now. If you look out, all my oak trees already have leaves on them and dropping these buds. All the fruit trees have blossoms on them. The thing that disturbs me about that is I think we're probably going to have, like you said, a big freeze, and all that's going to go away, and then it's going to return again. Lake County is a high allergenic area with all the grapes and the walnuts and the kiwis and the marijuana and everything that's out there now that can really irritate.
Do we grow kiwis?
Yes, we do. Upper Lake.
Really?
Vic Barnes, who was
I thought that was like a tropical thing.
Big pioneer of Lake County, was a big kiwi producer.
Super cool. Wow.
And there's, I don't know how many more people do that. Vic has since passed on, but he's left a legacy in Lake County that's quite large, where the winery is, Ciego, out on Highway 20. That was all Vic Barnes' property. Wow. And of course, we have olives and grapes and wheat and hay. And, it reminds me of back in the Midwest where I grew up, but it was strictly all corn, weeds, hay, oats, soybeans, no fruit because the climate didn't really work well on it. Yeah. But lots of corn and those kind of things. So, but here, and I had a high amount of allergies as a child. I was taking Benadryl all the time because I couldn't even see. My eyes would swell up so much. And now my problem with allergies are mostly here, spiders. I live on the water, and the spiders are terrible. And I can just take down a spider web, and all of a sudden my eyes swell up so bad I can't see straight. I have a hard enough time seeing straight anyway, so when something like that happens. Our number is 263-5252. If you have any questions about anything we're talking about, be sure and give us a call, 263-5252. We talk about cholesterol and statins all the time, and Consumer Reports came out with an article this week that said cholesterol-lowering drugs may be linked to diabetes. And you may have concerns about taking a statin, such as atorvastatin, which is Lipitor, or rosuvastatin, which is Crestor, or simvastatin, Zocor. They did a recent study, and they linked those drugs to an increased risk of diabetes 2. Now, diabetes 2 is one that you get later in life. Diabetes is one where your pancreas doesn't function and you have to have insulin the rest of your life. But the experts say that the risk of diabetes is much less than the protective benefits of the statin. So don't skip a statin if you need one to lower your cholesterol. That's not a new side effect. We've known this for a long time. The Food and Drug Administration added it to the label of all statins in 2012. And that was a long time after we knew that. They found a slightly elevated risk. One study that reviewed 13 controlled clinical trials of statins found out that 4.9% of those people who took one of the drugs for 4 years developed diabetes, compared with 4.5 who didn't. I went on and looked at the blogs on this site, and there were a lot of people that were older, that got type 2 diabetes, and probably on the minimum level. Many of those corrected it with more exercise and change of lifestyle. This new study that was published in the Journal of Internal Medicine raises questions about where, if the diabetes risk is higher than previously thought. They looked at the data of nearly 7,000 people with an average age of 53. About 31% of those who took a statin for an average of 5.5 years developed diabetes, compared with 19% who didn't. Now, that seems high to me. If a third of those people developed diabetes, and here's where the problem goes. This was not a randomized controlled study. The gold standard for determining whether a drug causes a particular side effect is not known for sure that the increase in diabetes was entirely due to statins, because they might have had other factors that contributed. And we call these things double-blind studies when you compete with another medication. But when you're not competing with another medication and just testing the one drug, you have to take in every other kind of factor. And one of those factors could have been age. Another one of those factors could have been smoking. Another one of those factors could have been obesity. Another one of those factors could have been high cholesterol. So the risk of diabetes with statins is relatively low, and likely outweighed by the potential benefit of the medications to reduce the bad cholesterol studies. Previous research found that every case of diabetes statins triggered, they prevented at least 3 heart attacks or other serious heart problems. So the bottom line on all this is that the remote risk of developing type 2 diabetes should not deter you to influence your decision to use a statin. Now, there are other side effects of statins that may bother you, and one is a memory situation. To figure out if a statin makes sense to you, it estimates your overall risk of heart attack and stroke in the next 10 years by doing a cardiac risk factor based on your total cholesterol, your HDL, your good cholesterol, your age, blood pressure, and whether you smoke or have diabetes. So the people that are at a low risk of heart attack or stroke, less than 10% over the next 10 years, diet and lifestyle changes. And you've heard this from me so many times. We don't want to change our lifestyle. If we can take a statin, even though the risk of that is developing diabetes, then we'll take a pill for the diabetes. So, but if you're a low risk of heart attack or stroke is less than 10%, you can do it with diet and lifestyle. That includes a diet that's low in saturated fats and trans fats and cholesterol, and making lifestyle changes, exercising, losing weight. Those changes alone could reduce your LDL and your heart attack, stroke risk low enough that you won't need to take a statin. So if you already take one, these changes might allow you to discontinue your medication or lower your dose, which in turn could lower your risk. So there is a calculator that can be found, I think, online. That is our Best Buy drug report on statins recommending using this calculator. And I would go to Consumer Reports online and put in high-risk calculator and see what happens. I haven't had time to do this. I go to a physician every 90 days, and because I have a low HDL, which is the good cholesterol, I'm at risk for my LDL is fine, my total cholesterol is fine, but my HDL, which is the good cholesterol, is low. There's very few medications to bring the HDL, the good cholesterol, up, which would lower your cardiac risk. So I have mine tested every 90 days, and always it's the same. The LDL is fine, the cholesterol is fine, but the HDL needs to be considered. So I don't take a statin. I don't take any medication for high cholesterol. I've been able to avoid that by controlling it. Even a statin would not raise my HDL. We're going to take a break, and when we come back, we're going to talk about these nasal decongestant sprays and why they make you sicker. Happy New Year, everyone. This is Bill Kearney of Northlake Medical Pharmacies. As we enter a new year, we at Northlake Medical Pharmacies can reflect on the last 36 years and see the significant changes that have affected the healthcare industry, especially the Affordable Health Care Act, and more importantly, you. Even with all the changes, our mission has always been the same, to provide you with the best customer service possible. We want to answer all your questions before you leave our pharmacies. If we don't do this, then our pharmacists are available on the phone to answer those questions. We at Northlake Medical Pharmacies know you have a choice. When you have your prescriptions filled, we feel a great sense of appreciation to you, our customers, for making us your choice when filling your prescriptions. We look forward to serving you in 2016 at both of our pharmacies, at Hill Road next to Sutter Lakeside Hospital, and outside Bruno's Shop Smart on Lakeport Boulevard. Just remember, free delivery to Lakeport, Nice, Upper Lake, and Lucerne, and now to Kelseyville, the Rivieras, and Buckingham.
This may sound like a typical high school basketball game being played on a Friday night in California. In fact, it's a crash course in cooperation and teamwork. It's a test of dedication, determination, and drive. It's character development in action. If you think high school sports are only about competition, think about this. High school sports can play a critical role in a student's overall education. In fact, studies show that students who participate in school sports are more likely to enjoy greater levels of achievement in their academic lives. At the same time, playing sports helps teach lessons not covered in the classroom. Lessons like tolerance, respect for the rules, and the importance of supporting your community. High school sports, a winning part of a complete education. This message presented by the California Interscholastic Federation and the California State Athletic Directors Association.
We're asking folks about marriage.
Marriage makes me think of sports. You know, teamwork, dedication.
Okay, let's see what people say.
Let's say your marriage is a sport. What sport would it be?
Basketball. Surfing.
They have to be a team sport.
A lot of back and forth.
A lot of people watching.
So how many people are influenced by your marriage?
Hundreds.
You really think about the ripple effect.
It's like a wave.
Want to improve your marriage? For ideas, go to foryourmarriage.org and message from the Catholic Church.
A single ember that escapes from a wildfire can travel over a mile, carrying a world of trouble. It can land, ignite, and destroy your home and community. You can't control where that ember will land, only what happens before it does. With simple things like clearing areas around buildings, knowing community safe zones, and being prepared for wildfires, you could keep this from turning into this. Your home is better protected from wildfire when your whole community is prepared. Visit fireadapted.org for more tips on how to get started adapting your home and community to wildfires. A public service message brought to you by the U.S. Forest Service and the Ad Council.
And we're back.
All right, I forgot to tell you something, Paul.
Uh-oh.
I jumped in the lake on Saturday for Special Olympics. And
Were you a chicken?
43. No, I wasn't a chicken. I was a jumper.
In the lake, okay.
So I had Brad Rasmussen, the chief of police of Lakeport. He stuck right by me. He said,
right.
if you fall, I'll be right there to pick you up. So I took my cane, 43 degrees, and jumped in up to my neck. And got back out. We raised over $20,000 for Special Olympics in Lake County.
Great.
Lots of community support. Your St. Jude thing made me think about it because even though the Valley Fire and the fires, people still dug in their pockets to help the Special Olympics.
That's
and
great.
I think that we'll find that the more community gets involved, that it will be people are just very giving. Even people, I talked to a contractor in Cobb, and he's building 5 homes up there right now, and he has 5 more that he's getting permitted, and a lot of people are rebuilding, which is great news, and hopefully their insurance has covered most of that, and we need, but people, when there's people in need, they pull out their pocketbooks and they help even if they don't have money themselves.
Sure,
so, but I wanted you to know that I braved the cold and had my cane.
Did you dress up?
Well, I had a Lions Club apron on, and I didn't realize it was hanging down to my waist. I thought, I was so cold standing there. But then I wore my cap that had my gray hair on it.
Yeah.
So I looked a little bit younger than I really was. But I had my cane in case I fell over, and it was a little wobbly going out there, but we've had times when we had to go out a substantial amount before we got to the water, and the water was up at a high level. So very enjoyable, and Peggy and Steve Buckholz did a great job, as well as the Special Olympics Committee, and getting people to participate. So it was a lot of fun. You've used nose sprays before, right, Paul, with your congestion?
Yeah, right now I have
Flonase.
Flonase,
yeah.
yes.
And there's an over-the-counter one that's that causes a lot more trouble, and it is oxymetazoline is the generic name of it, but it's Afrin and Dristan and Viccinex, and anything that says 8 to 12 hours on it is oxymetazoline. That drug shrinks swollen nasal tissues quickly, and it works great. And it usually causes fewer side effects than oral decongestant pills because very little gets absorbed into the bloodstream. I use that drug, and I'm very careful about using it. I get into times of the year, and this is one of them, where starting about 4 o'clock, I just start shrinking those membranes, and I start having trouble breathing nasally. And if I spray one spray in each nostril, that lasts me until the same time the next day. And it works so well that if you're not aware of the fact that that's happening, you get what we call a rebound effect. So the more you use it, like if you think in 3 or 4 hours you need it again, you use it again, and then you use it once during the night, and before you know it, you're using it 3 or 4 times a day. This rebound becomes effective, and those sprays are a temporary fix, and they come with instructions on stop using after 3 days, because using them longer than that increases your risk of this rebound nasal congestion. So it happens when the nasal tissue can't shrink back to its normal size and instead stays swollen and becomes even further inflamed. And using them long term, months to years, can even lead to something more dangerous called atrophic rhinitis. It's a rare but difficult to treat condition marked by uncomfortably dry nasal passages, sometimes with chronic crusting and in some cases loss of smell. So if you're using an OTC, over-the-counter nasal decongestant spray, and still feel stuffy after 3 days, switch to something like Sudafed pills. Now you have to go up to the counter of the pharmacy and sign for it because they're available without a prescription, but you need to sign for it with your driver's license, date of birth. Some people are sensitive to that too, and it increases their nervousness or dizziness, or doesn't allow them to sleep. But side effects of these can be life-threatening, but seldom are. Also, don't bother with decongestant sold on open store shelves. And I sell these things. Sudafed PE and generic phenylephrine doesn't work that well, if at all. Now, my experience is it does help, especially if you're trying to get off oxymetazoline or Sinex or Afrin or any of those 12-hour things. Even though it says neosynephrine on it sometimes and it says 12-hour, it's really oxymetazoline because they sometimes try to sell you that even though it's a different product. It's like if you go to Dristan spray, and instead of the active ingredient that usually is in it, it's oxymetazoline. So for a safer route, try using saline washes or saline sprays. There's a spray that's salt water, and there's a spray called Ocean Spray, very inexpensive, and it rinses out it works to relieve congestion in two ways. It draws out the excessive water trapped in your tissues, acting as a natural decongestant, and it rinses away allergens that could otherwise stick into the lining. Now, you can get a nasal spray like Ocean Spray, or you can get a neti pot. A neti pot is using some tap water or bottled or filtered distilled water, and buy a pot that you put that water in and use it as a rinse. And they're very effective. And eventually, that will get you off of the Afrin or the oxymetazoline. So be careful. That drug used to be on prescription. And the reason it was on prescription was because after 72 hours, there were people, I won't say addicted, but dependent on using that. And the more they used it, the more they had to use it. And pretty soon, they couldn't breathe with using it because the intervals in between got to be so small. So there's nothing wrong with buying oxymetazoline or Sinex or Afrin. I still buy it. I still use it. But you have to discipline yourself in what to do because it is going to be highly dependent. You're going to be highly dependent on it if you don't observe the no more than every 12 hours and no more than 72 hours before you use something else. So we talked a little bit last week about some of the drugs that you're taking and that's used for different things than what you normally would. And one of the things we talked about was quinine sulfate for nighttime leg pain. And one of the options for restless leg syndrome is a drug called Mirapex. And it starts out at 1.25 milligram. Now, frequently what happens is people start out at 1.25 milligram, and it works for a long period of time. And the doctor gave you refills, and you just go back and get it refilled. And over a period of time, that 1.25 milligram isn't effective anymore. Excuse me. And what happens is sometimes the physician forgets to tell you or just orally tells you and doesn't write it on the prescription. So every 4 to 7 days, you can raise that 1.25 by one more tablet. So you can go up as high as 5 milligrams every night, 2 to 3 hours before bedtime. And that's really the maintenance dose for RLS, for restless leg syndrome. But many people are being under-medicated because they haven't changed from that 1.25 to a more of a dose. And in between time, possibly, you've been prescribed Klonopin or Valium or another drug that's supposed to help. And but you might not have needed it if that Mirapex had been increased. So talk to your physician about it if you're still taking 1.25 milligrams of Mirapex and you're taking it for RLS, and see if it's okay. I can tell you it's safe, and that's the main thing. And it kind of bugs me that there is an extended release Mirapex that I think is 3.75, but it's for Parkinson's disease. You don't need an extended release prescription for RLS because it's mostly at nighttime. You need to be very disciplined and take it 2 to 3 hours before you go to bed, and you need to be taking it at the right milligram. So speak to your physician about the possibility of increasing it if it's not as effective as it once was. It doesn't mean the drug wasn't good for you. It just means you've got used to that dose, and it takes about 4 times what you're taking to be the maintenance dose. So that's an example of, and the Klonopin that I talked about was something that they use also for RLS because it's longer acting. And the gabapentin and trazodone, all of those things can be prescribed just for that one condition. And you may only need one medication to do that. So whenever you're on a new medication that you don't know about, ask your physician. If the physician doesn't have the information, certainly ask the pharmacist. The pharmacist is going to tell you what the side effects are, and he's not necessarily going to tell you to titrate the medication up because it's not on the directions. But and we don't want to over prescribe a physician, but in cases like this where there probably isn't any feedback about what you're doing, then you need to know for sure how far you can go with treating yourself with this medication and make it effective. I don't know how many people have dizziness. A lot of people do, and people don't really know what it is. Most of the time we call it vertigo, and we tell them that we put them on meclizine or something like that. But there are things like bouts of dizziness that physicians will say you had ear canal stones, and that's the medical name is benign proximal positional vertigo, and that's a spinning feeling when you move your head into certain positions, which differ from person to person. So it occurs when tiny ear crystals migrate into the fluid-filled canals that help keep you balanced, and they keep the fluid in motion even when you're still causing dizziness and sometimes vomiting. It usually clears up on your own. There used to be a physical therapist at the hospital that would treat that, and your doctor can guide you through head movements to reposition those stones, and it helps up into 85% of the cases. So if you have dizziness, tell your doctor. It can signal a more serious condition, or a drug might be effective. Did you ever use Epsom salts, Paul?
I have not.
You never had, you played ball. You never had a swollen ankle or anything.
No, I've seen my mom do it. My wife has done it before, but I don't think I have.
I did it one time when I was pouring concrete, and I got concrete poisoning, and my foot. I was wearing flip flops, and got sand in my flip flops and got an open wound. A lot of people want to know if that really works for muscles and sprains. Inside the muscle cells, magnesium sulfate, which is the main ingredient, promotes healthy muscle function and recovery after exercise. But there's little proof that it can be absorbed through the skin. So simply soaking in warm water can increase circulation, which helps speed healing and may reduce the brain's perception of pain. There's always evidence that moist heat works faster than dry heat, such as a heating pad. So I would still use Epsom salts. We used it on horses when I was growing up on the farm. We're a little bit different than a horse, but if it makes you feel better, there's no problem in using it. Whether it's effective or not, or whether it's certainly the placebo effect, you don't know. So just be careful about open wounds and things like that, which was what I was dealing with, and I put my foot that had a rash on it into the Epsom salts, and I almost screamed bloody murder, but I got out of it.
Does it hurt? It like stung?
It stung with an open wound. It doesn't if you if you just soak a closed wound. A swelling in there, it doesn't, and it does help the swelling go down. And whether the Epsom salts, which is magnesium sulfate, that can be used for a lot of different things, whether or not it has a pharmaceutical effect or not, they're not sure. So it's hard to really measure something like that, which is external. And when a person comes out and says it feels better, whether it's from the hot water or whether it's from the medication. We talked a little bit a couple weeks ago about a new sleeping drug called Belsomra. And it has, and I don't know why, we're getting a lot of drugs approved now by the Food and Drug Administration that we never would have got approved before. And they found that, and this is extremely expensive, and they found it was associated with side effects such as agitation, disturbed sleep, next day drowsiness, or it didn't work at all. And that's because it's the first of a new type of sleeping pill with limited evidence supporting its safety. So one way to do that is through adverse events, which come from consumers and healthcare professionals. If we get somebody that, and we've sent a report in several times about Lyrica, people getting really bad reactions from Lyrica, and it's called the devil drug, and a lot of people. And this drug is similar to Ambien, only the side effects are greater. All sleep medications really have a long list of potential side effects, but most of them are similar to the older drugs, which are the benzodiazepines with the Restoril and Dalmane. A couple of the newer drugs, Ambien and Lunesta, have some adverse side effects that are unusual and don't go away. But this one, that between January of 2016, this report came out, and between February 15, when this first hit the market, they received more than 1,000 reports from the drug that didn't work as expected. So a substantial number of reports about side effects in the first 6 months of 2015. Only about 95,000 prescriptions for this drug was filled, compared to 18 million for Ambien and Lunesta. Merck, who makes this, said that it's monitoring adverse events and that the flag to date outlines events which are adequate warning for physicians. So they have said consumers that they would not recommend it. People reported that it didn't work. Their ineffectiveness was up to 40%. Disturbed their sleep. Nearly a third of the companies or complaints were about disturbed sleep. 28% said it made them less alert. And about 1 out of 5, or 20%, noted that they had the opposite effect. Rather than helping people sleep, it made them agitated, irritable, or nervous. Finally, the prescribing information for the drugs has a risk of suicidal behavior or depression. So short track record has lingering concerns on whether or not that's something that you should be taking. Before it was approved, only 160 people took it for a year or longer. And while the FDA approved the drug in dosage strengths from 5 to 20 milligram, the 5 milligram wasn't studied at all. And the 10 milligram was only studied in 62 people. So this disturbs me a lot. A powerful drug like that on the market, and that's all the testing that took place. I'm not going to say Merck paid somebody off, but it's highly unusual for that drug to be causing that many side effects and not be tested any more than that. All sleep drugs carry a risk of side effects, and that's not unusual. And it can cover up symptoms and doesn't always get to the root problem that's causing your insomnia. But was that me? But the sleeping pill doesn't always solve that problem. That's why when we put you on an antidepressant, for example, we tell you that might help relieve your depression, but your depression was caused by something else. This medication isn't going to cause the source of your depression to go away. You need to get counseling. You need to find out what that was. It might have been losing a partner. It might have been a death. It might have been a suicide. It might have been something, losing a job. It could have been anything. But you need to get over what it was. And all this pill does is try to bring you up to a level, and forgetting about the cause doesn't really help. I go back to the war and think how much you suppressed things in the war, and then an antidepressant doesn't normally solve that. But I'd like to remind you we're North Lake Medical Pharmacy with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192, and outside the Bruno Shop Smart at 347 Lakeport Boulevard. Call us there at 263-1328. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again next Wednesday for Health Talk on AM 1270 KXBX.